the government could impose stiffer measures within areas identified as hot zone for the spread of coronavirus. According to Health CAS Dr. Rashid Aman, the trigger point for the imposition is looming as the government gears up to take the fight against the spread of the deadly virus a notch higher. Among the regions which risk a lockdown include the Kibra slum in Nairobi County, where the number of those infected has already surpassed the 200 mark.
We are identifying and mapping that, and I think once we have enough information and we feel that the numbers have now reached a point where a particular measure needs to be taken, as I said before, these measures are always on the table. Those measures will be taken.
This was the message Tuesday as Health Cabinet Administrative Secretary Dr. Rashid Aman rose to the podium in what is the daily ritual by the Ministry of Health at Afya House. Aman saying that the fight against COVID-19 is far from won, with Kibra constituency now worst hit by the pandemic. This comes at a time when sections of Kenyans remain oblivious of the risk they are in, following continued disregard for guidelines given by the Ministry of Health in a bid to tame the spread of the novel coronavirus. Leaders and truck drivers have yet again been put on the spot. Health CAS Dr. Aman regretted that truck drivers remain the weakest link in the fight against coronavirus at the country's points of entry.
I want to appeal to them to pay attention to the guidelines, and if they fail to do this, then they will create a problem.
This even as the country recorded 72 more COVID-19 cases in the last 24 hours, bringing the total number of those infected nationally to 2,093. As the virus continues to sweep across 34 counties as of Tuesday, the debate on whether it's time or not to impose a lockdown in the mapped coronavirus hotspots remains rife. Globally, over 6.4 million have contracted the virus, nearly 3 million have recovered, and over 270,000 others have succumbed to it. Reporting for TV47, I am David Mudhoka.